even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212 Choices, 212 Choices for a fresh second opinion. Most insurances, Medicare, Medicaid, accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212 Choices. With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based on PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accepted. Call Dr. Lederman at 212 Choices, 212 Choices for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212 Choices. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212 Choices.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hey, we're back. We're back taking your calls. You're welcome to call us at 212 Choices. This is Dr. Lederman. We work at a place called Radiosurgery New York at 1384 Broadway and 38th Street, so almost everyone knows where that is. We're located on Broadway, just between Macy's and Times Square, so it's easy to get to us. That's why we say it's super convenient. You can take the subway, you can take the buses, you can take the train. You can come in from Long Island or New Jersey or Boston and come to Penn Station or Grand Central Station. You can take the train. You can take the bus and come to Port Authority. We're about a 4-minute walk from Port Authority, just a couple of minutes from our office. You can take the PATH trains from New Jersey. You can drive if you want. It's super convenient. For those in Manhattan, you just walk over and see us. So we are super convenient, but we're not just convenient. We're super. Why? Because we take most insurances, Medicare, Medicaid. We're a private cancer center, which means we know you, you know us, you're our boss. We don't work for the drug companies. We don't work for the president of the hospital who makes, I don't know how many, you know how much the president of hospitals make in the tri-state area? You know what, now, hospitals are non-profit, right? Non-profit. Well, guess how much the highest paid president of a hospital in New York makes? Take a guess. Would you guess $22 million? $22 million. A president of a non-profit makes $22 million a year. Hey, are you coming to pay his salary, or are you coming to get better? Well, we think you want to come and get better. And we think you want to be boss because you are boss, and we should be working for you, not the drug company, not the president who's making $22 million a year. And I think you want to see a triple board certified doctor, not the students, not the interns, not the residents. Yeah, students are great, but maybe you want the board certified doctor. Maybe you want to talk to him, not a machine. That's why we are Radiosurgery New York, and that's my name, Dr. Lederman. We're at 212 Choices. So we're not only super convenient, we're close to trains, buses, subways. We have something called the Urgent Cancer Consultants, just by calling us at 212-246-4237. We promise to see you within one business day. We think you should give yourself the most chances, give yourself the most choices, by calling us at 212 Choices. We take most insurances, Medicare, Medicaid. You're the boss, not the $22 million a year president of a hospital, not the drug companies. You're our boss, and we work for you to provide you information that you can make sense of. We give you copies of your reports, your pathology, your PET scans, so you can sit down and analyze and see, yes, you got all the information. You can decide. We're not hiding anything from you. Hey, we had a patient who came in I want to tell you about this week. 36-year-old woman from Dominican Republic. Yeah, we have patients from all over the world. We had a family fly in from Italy this week. I told you about the family from Rhode Island, another family from California. Well, this is a 36-year-old woman with colon cancer. She's a mother of two, and the cancer is already metastatic to the liver, which means stage 4. She presented at age 35 about a year ago with abdominal symptoms during a pregnancy. She had diarrhea, abdominal pain, bleeding. At that time, she had a biopsy of the liver, which showed metastatic adenocarcinoma. She was diagnosed in July 2013. She's at one of the big hospitals. The president there makes $3 million a year. And she's been getting chemo from July 2013 until now. She lost 50 pounds. She went from 190 pounds down to 140 pounds. She lost 50 pounds in 1 year. She's 5'0". So do you think that chemo is well tolerated? I don't think so. Do you think it's working? No. She's had no PET scan. We're getting her staged up to know exactly where the cancer is. We gave her a copy of the report showing adenocarcinoma. It says colon cancer, adenocarcinoma, metastatic to the liver, on chemo for nearly a year at one of the big hospitals, not working, not tolerated, lost 50 pounds. She wants new options, and that's exactly what we do, whether the cancer is in the prostate, the breast. Here's a cancer metastatic to the liver from colon. We're able to stop it, most likely, where we attack without systemic effects. Our success rate is about 90%, and it's non-invasive. Treatment takes about 15 minutes. You walk in, get a treatment, and go about your business. Isn't that almost perfect? We think it's almost perfect. We're always working on perfection. There's a new report showing that by delaying treatment for breast cancer, that the prognosis falls. Now, we know that black women have worse prognosis with breast cancer, but it's not because one is black or green or purple or yellow. No, it's because of a delay in treatment. You don't have to delay to get treatment. That's why we offer to see you within one business day, if you wish. You don't have to, but if you wish. Well, there's a study out from a major center in Texas that looked at 6,800 women diagnosed with breast cancer between 1997 and 2011 who were treated at this place in Texas. And they looked at the time to implement therapy. Was it less than 30 days, 30 to 60 days, or more than 61 days after surgery, whatever that was, whether it was removing the breast, which we hope not, or lumpectomy. We like to save the breast whenever possible. But for the women who got treated within 60 days, the prognosis was better. The women who waited, the prognosis was worse. So it wasn't based on anything other than wait. And waiting is in not your interest. Waiting means the cancer's being given a head start. The cancer's allowed to grow. Why would you want that? You don't want that. You want to get treated in a timely fashion. So please, give us a call. Don't wait. It's like a rotten tooth. It's not going to get better by itself. Give us a call, 212-CHOICES, and learn the options. Maybe better than you think. Usually it is. And we have a final note about a man. A man went actually to another hospital. He called me from the operating room. He had prostate cancer, Gleason 7. They were going to do surgery on him. He called me. He said, Dr. Lederman, what's my best treatment? Should I go through this? And I said, well, for Gleason 7 cancer, surgery is not your best option. He put on his clothes and ran out of the operating room. He came to us. We gave him our best treatment, which is 25 treatments in the stereotactic frame and prostate brachytherapy. He was told elsewhere, oh, brachytherapy is so terrible, and you're going to be suffering and dying and pain, and you need narcotics, and you can't have sex. And so a week ago, 10 days ago, he got his brachytherapy, and he called me up. He said he didn't feel a thing. He's having sex. He's having his life. No pain, no cutting, no bleeding. Doing great. And that's what we try to achieve for every patient. So give us a call that may be applicable to you. Give us a call at 212-CHOICES, 212-CHOICES, to learn about the best options for you. Thank you for tuning in. If you have questions, call us at that number, 212-246-4237. Thank you for listening. God bless you, and thank you.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. This is Rob Redstone. Till next week.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board-certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day, because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
You know, when you're talking the big C, cancer, a lot of times people have gone through prior chemosurgery or radiation, and
at Radiosurgery New York's Urgent Cancer,
it just didn't work or didn't get the desired effects. All of a sudden you want to get an opinion on what to do. Well, Dr. Gil Lederman treats not only newly diagnosed and recurrent cancers anywhere in the body, but definitely will specialize with those folks who already been through a process that didn't work, and now they're trying to reconfigure in terms of what they can do, and he goes one-on-one with you. In fact, he'll send you an informative booklet, DVD, and arrange a prompt meeting to discuss all choices at his convenient office located on 38th and Broadway in Manhattan. He's a brain and prostate cancer as well as body cancer expert, also treating breast, lung, pancreas, liver, kidney cancers, and more. And back in 1991, I referred my dad to Dr. Gil Lederman, and he came up with a solution for his medical problem. Harvard-trained radiation oncologist first brought non-invasive stereotactic body radiosurgery to America. He has the longest experience treating cancer using radiosurgery with no cutting, bleeding, anesthesia, or hospitalization. So just call Dr. Gil Lederman for your cancer treatment choices at 212-CHOICES. Write that number down if you want to refer someone to call, or call Dr. Gil Lederman for that person at 212-CHOICES. That's 212-CHOICES. Two choices. Two choices. Two choices. Two choices. Two choices. Two choices.